10 years is a long time to do anything. 10 years is a very long, in fact, it's a lifetime away if you think about it. 2011, around this time, 10 years ago, something happened, barely perceptible, but I guess it must have come in the form of an email notifying the commencement of the Sidhas project. At the time, no one really knew how it was going to turn out. But 10 years down the line, we are here today to tell the story of what has happened on the Sidhas project in the last 10 years. And believe me, it is nothing short of phenomenal. My name is Dr. Kolawole Olatubosun, and I'll be functioning as the moderator for today's event. I'm wearing many hats. The moderator, I'm a staff of FHI 360, a proud one at that. I worked on the Sidhas project for as long as 8 out of those 10 years. And I'm privileged to be standing in front of you today as the moderator. So I'll be standing, wearing many hats in the course of the event. Without much ado, we will get there. How the work was done, what was done, who did the work, will be shown to us very clearly in the course of today. But I have to say the Sidhas project was made possible through the very generous support of the United States government and, of course, the cooperation of the Nigerian government. And the lives that have been touched, beyond the numbers, there are people, there are families behind those numbers. It is that story we are going to tell today, and I do hope that you really, really take in all we have to offer. Ladies and gentlemen, you are warmly welcome. Before we take it over, just a few housekeeping rules. If you look around you, you'll see an elephant. Can you all look around? Okay, maybe not a physical elephant, but there's an elephant in the room in the form of COVID-19. Yes, it colors everything we do. That's why we have masks. In fact, these days, you hardly can recognize people without their masks on. If they show you their faces with masks, without masks, I don't know you. But when they put on the mask, oh, I know you. So please kindly put on your masks for the duration of this event. Avoid handshakes. We have hand sanitizers on the tables. Kindly use them. Use them very copiously. If you would like to take a biologic break, there are conveniences just behind the exhibition area. As well as if you would like to take pictures, I can see a lot of pictures being taken. When you want to upload them, please use the hashtag Sidhas completion event. Sidhas completion event as just one word. Without much ado, I'd like to invite to the stage the acting country director for FHI 360 Nigeria, my boss. She doesn't know that she's one of my most favorite person, but I'm telling you right now in front of everyone. Dr. Hadiza Kamofu. Please, with a big round of applause, kindly welcome her as she comes up stage. Thank you very much.
The chief host at this event, the Honorable Minister for Health, Dr. Osage Ehanire, ably represented by the Director of Public Health, Dr. M.O. Alex Oko, the special guest of honor, Dr. Kathleen Fitzgibbon, U.S. Chad D'Affaires, representatives from the government of Nigeria, specifically NACA DG, Dr. Gambo Aliyu, representatives from the UN agencies, and specifically we have here represented the UN AIDS country rep, represented by Caroline. We also have other US missions, the DOD, that's Department of Defense, as well as the CDC, other implementing partners, distinguished ladies and gentlemen, I will say a good day to you. My name is Hadiza Kamofo. I'm the Acting Country Director for FHI 360 in Nigeria. And on behalf of the Strengthening Integrated Delivery of HIV/AIDS Services, the Sidhas team, as well as our global FHI 360 family, it is my great pleasure to welcome you all to this event, including everyone who is joining us virtually. Unfortunately, because of COVID, we had to limit the numbers, so majority of our team members are actually joining virtually. I want to thank you for making out time from your very busy schedule to join us today as we mark the completion of the Sidhas project after 10 years of implementation. I say that with a lot of emphasis. Being given the opportunity to implement a project as big and as complex as Sidhas is the exception and not the norm. And spending 10 years of implementation is a rare privilege and an honor for the Sidhas team and a lot of the stakeholders who have participated in making this project a success. The Sidhas project has saved a lot of lives and has impacted lives positively. This was achieved with the generous support of the American people with funding from the US President's Emergency Plan for AIDS Relief, PEPFAR, through the US Agency for International Development, USAID. We wish to appreciate the government of Nigeria at the national and state levels for being very receptive and providing an enabling environment, as well as for their tremendous contributions throughout the 10 years of this project, Sidhas. We wish to specifically appreciate the network of people living with HIV/AIDS in Nigeria, NEP1, including the Association of Women Living with HIV/AIDS in Nigeria and the Association of Positive Youths Living with HIV/AIDS in Nigeria, at both the national as well as the state levels, for their cooperation and contributions to the success of this project. The Sidhas project commenced in September 2011 and was designed to consolidate the achievements of the GAME project, which was also implemented by FHI 360. The Sidhas' main goal was to sustain cross-sectional integration of HIV/AIDS and TB services by building Nigerian capacity to deliver sustainable, high-quality, comprehensive prevention, treatment, care, and related services. Implementation strategies were tailored to achieve 3 key result areas. Number 1, increase access and coverage to HIV and TB services. Number 2, improve integration of quality services. And number 3, improve stewardship of government, ministries, departments, and agencies for sustainability. We are happy and proud to say that together we have all achieved all of these goals and even more. Over the course of the 10 years of implementation, the project has evolved with changes in strategic direction, not only through PEPFAR 1.0, 2.0, and 3.0, but also through 2 phases of the National Strategic Framework and Plans as led by NACA. These changes were necessary to improve HIV program transparency, accountability, effectiveness, and efficiency. We clearly could demonstrate doing more with less, including deployment of resources where they are most needed. This event has been put together to share just a bit of the key accomplishments, successes, challenges, and lessons learned, and other experiences across the states and communities where we have worked. We sincerely appreciate the contributions and sacrifice of all staff, consultants, interns, volunteers, who have served through these past 10 years, including government facilities, community-based organizations, consortium partners, all stakeholders, and USAID, without whom all of this will not have been possible. We welcome you all as we begin this event, and thank you immensely for honoring our invitation. Thank you so much.
Another round of applause. Thank you so much, Dr. Adiza. We'll take a couple of goodwill messages from various people. And just so that we keep to time, I want to implore everyone that will come up to keep it very short, just about 2 minutes. Once you're getting way past 2 minutes, you'll see me coming a bit close to you as a nudge. So to kick it off, I would like to invite the Director General of the National Agency for the Control of AIDS, Dr. Gambo Aliyu, for his comments.
The Honorable Minister of Health, ably represented by Director Public Health, U.S. Church Jafir, Honorable Kathleen, the USAID country director who was in my office last week to say hi before we meet today, and FHI 360 country director, invited guest, the people joining us online, and everyone, a very good afternoon to you all. I was thinking when I was coming to this place, what am I going to see? I was, and I'm still serving as the chairman PAC for this project, and this has been on for 10 years. And I met it at the tail end, which means the last 3 years coming on board. After Professor Idoku has chaired, and Sana Aliyu has chaired. Professor Idoku, a total clinician, and Sana Aliyu, both a clinician and an epidemiologist. And me, almost 100% epidemiologist. Coming and then looking at what you've achieved, I'm trying to think of what can I say to say thank you. One thing is, not because I happen to double as DG NACA and the chairman PAC, but because as a country, you know, and as you know all, when you are on stage and you're performing, there is the critical hour or minute which matters most. What is that matters most? Is the ending. Not what you've done at the beginning. You may be marvelous at the beginning, but if you drop the ball towards the end, that spoils everything. So I want to say, Sidhas project held on to the ball until the end. You guys did well. You guys did well. And you did very well towards the end because we gave you marching orders. You know, we told you these numbers are not adding up. There was a disconnect between the amount of resources that has been spent and the deliverables we see on ground. We are marching towards epidemic control. We have done nice, and we've identified that, well, the epidemic is not that big as we thought, but hey, look at it. It's almost 2 million people out there that are living with this virus, and you guys have only identified 800. This is not acceptable. How can you match the resources with action? And both of you, USAID program, CDC program, you responded, and you responded very well. And I must thank you, and I must thank you through PEFA, and I will thank PEFA through the US government, US consulate in Nigeria. Thank you for a very good job, a job well done, and we look forward to controlling this epidemic in a very short time. Thank you.
Thank you very much, Dr. Aliyu. one of his many hats is as the chairman of the project advisory committee. And you could see from the quality of the advice he's given, the kind of success we've recorded. Please, another round of applause for him, please. I would like to invite the Honorable Commissioner for Akwa Ibom State, is my teacher, Professor Augustine Umor, for just a brief comment to, goodwill message. Please give him a big round of applause. He's the one providing the immense and fantastic support for the work in Akwa Ibom State, and I'm not sure he needs too much of introduction. Professor Umor, please.
Thank you, Kola. The Minister of Health here represented, the Director of Public Health, the U.S. Chargé d'Affaires here present, the Country Director of USAID, the Acting Director or Country Director of FHI, all the wonderful people here that are working in the field of HIV/AIDS. I must also recognize my permanent secretary, Dr. Patrick Eshet, here present. Ladies and gentlemen, I have 2 minutes. Let me stop there so that I have more time to say a few more things that I need to say. Let me say that it's a huge delight to be here amongst you today to take a look and celebrate all the good things that we have had through the Sidhas project during the time of its existence. I must especially recognize the contribution of the people who have worked in the field in the control of the HIV/AIDS, the dogged nature that they've taken to push and to ensure that HIV/AIDS is driven out of our climb. Some years ago, as we worked at the onset of the project, and for some time, Akwa Ibom State was recorded up to the point that second on the list for the countries using the Sentinel study. And everybody was in the field struggling to ensure that we really control this, only to now have the nice, in 2018, and we recorded 5.5%. And this was one time when we were not too proud to take first. But we were first, and it became clear that a lot more work had to be done. I'm also here to express our happiness and real sincere thanks, and that the engine was revved even more, and we went into the search. From all that's been presented to us, the documentary evidences are all there. We could see that so much achievement has been made, and I did to challenge those who did nice to repeat one now, and I'm sure we will be first again. We could see that over 4 million pregnant women have been tested, and this is particularly very nice. But one thing else that is also gladdens my heart to see is the level of suppression that we have had, because what it means to me is that at least the transmission is being in check, such that while we are treating those presently who have already acquired the disease, we are also on track to prevent more people from getting the disease, and this is very nice. As if that is not enough, in the life of the project, people stepped aside to give some value-added projects or, yes, activities such as looking into the health of the pregnant women with the assessment of cervical cancer. And I just challenged some members of FHI that this is something very good to show. And I hope that in the few days to come, few weeks to come, we will even add this as a value-added project to show very well, bring it out, and also project. Because at the beginning of the project, we had a challenge, we had a worry that this was a unidirectional project targeting HIV, even while its name was integration. But you can see that we have all brought that together, and a lot of work has been done. All I want to say is thank you for all of us, and God bless all of us as we do even more. Thank you very much.
Another round of applause for Professor Moore. The Honorable Commissioner for Health for Cross River State is here represented by the state's AIDS Program Coordinator, and she is Mary Ama. Kindly come up for your comments. 2 minutes, please. Please, a big round of applause for her.
Good afternoon, ladies and gentlemen. Please permit me to stand on the already established protocol. And I want to appreciate God. It's not a light thing after my prof spoke that I come up here. I sincerely also send my commissioners apologies for not being able to be in this August occasion. I want to say that things that happen are divine. Having been a naive baby at the beginning of Sidhas, baby in HIV, in quotes, not knowing anything, but with the Sidhas projects, a lot of upbringing, a lot of training, and I'm happy that today God has deemed it necessary that I am the one representing my commissioner, because I have benefited so much from the Sidhas project. So I'm happy about that. With the Sidhas project, we know my state is sandwiched with a lot of in between other states like Benue, which has a prevalence rate of 5.3%, and our sister state, like we heard, 5.5%. Ebonyi is the least. But with the concerted efforts, the work of Sidhas, bringing innovation into HIV as the lead partner in the state, the last nice, despite the position of Cross River, we are at 2%. I think it's worthy of applause for the Sidhas project. With our viral load is at 96%. All our pregnant women are placed on, those that are positive are placed on long life ART. All forms of user fees were eliminated. Niverapine-based regimen eliminated. We are on dolutegravir, and about 99% of our clients are on multi-month drugs. These are all the things that have been done and more, as time will not permit me because I'm given 2 minutes. So I want to, as somebody that has benefited so much, like I told my state director, that I am a living proof of the Sidhas project in Cross River State. I want to sincerely apologize and appreciate the Sidhas project, Dr. Adiza and her team all over. Thank you so much for the work in Cross River State.
I think the Sidhas project has a lot more beneficiaries than we thought. Madam, thank you for that. And we do hope that the impact will be felt far long after we are ending the project. At this point, I would like to invite to the microphone the representative from UNAIDS, Caroline Olwande. I hope I got that right. Thank you. Please, a round of applause for her, please.
Thank you, Mr. Master of Ceremony. honorable guest representing the Minister for Health, Director of Public Health, Dr. Alex, the special guest of honor for this event, the U.S. Charge d'Affaires, Dr. Kathleen. I see fellow colleagues from other U.S. agencies, Rachel, Dr. Mary, good afternoon. Distinguished guests, ladies and gentlemen, all protocols observed, I bring you warm greetings from Dr. Erasmus Mora, the UNAIDS Country Director, who is currently on official travel duty and was not able to be here, but I know that he would have loved to be here. So on his behalf, I'm here to deliver the goodwill message from UNAIDS, and I'd like to deliver it in two parts. First, appreciation of all the efforts that have yielded this celebration, because really it is a celebration of all the achievements over the past 10 years. And then the second part is the future directions. We have achievements, but we are not yet there. And so for the part of the appreciations, of course, like the previous speakers have said, first it's to appreciate the government of Nigeria, because without them, then the enabling environment to be able to do all that we do to reduce the public health threats of HIV, COVID-19, and other health challenges would not be possible. To the government and the people of the United States of America for their generosity and continued solidarity with the world and Nigeria specifically through PEPFAR, USAID, and the FHI 360 project that we have benefited from for the last 10 years. To the Global Fund, we know that the FHI 360 is also a principal recipient under the current Global Fund grants, and that there's still support to ensure that the needle is moved further in terms of ensuring that we achieve epidemic control. To the UN family, where I belong, and other development partners, bilateral and multilateral, for the development support that we provide as we support all the initiatives towards moving towards the SDG 3, good health and well-being. And last but not least, to the communities, the PLHIV community networks and civil society organizations. I saw my brother and my son, Abdul Kadir from NEP1, for your relentlessness and shared responsibility, ensuring that the resources that are available, whether from government or development partners, actually translate into impact for the most deserving, the people that are suffering the burdens themselves. Congratulations to FHI for the achievements. We are aware that it's a major force behind the HIV treatment successes in Nigeria, and as articulated in the documents, the Sidhas project has enabled treatment for over 470,000 Nigerians. And as the HIV PR, we know that FHI 360 will move the needle further. It's an excellent demonstration of the ability to translate investments into life, giving hope to many men, women, girls, and children in Nigeria, and indeed, as we say in UNAIDS, the spirit of making the money work. Kudos to that. The project has been a major contributor to the post-NICE HIV response, as mentioned by the NACA DG. The NICE enabled the pivoting of the response and enabled targeted approaches for the investments, as we have heard from the Commissioner for Health in Akwa Ibom and Cross Rivers. And we are proudly associated as UNAIDS because we do have a state-level officer present within Akwa Ibom to have participated in those contributions. Ladies and gentlemen, we are aware that there's a new global AIDS strategy that was adopted at the UN high-level meeting in June, whose mantra is end inequalities and AIDS. We didn't achieve the 90-90-90 mainly because of the inequalities therein. And we are proud to be here to witness what has worked over the last 10 years that the Sidhas project has been resident in Nigeria. And we look forward to ensure that the best practices and the lessons that will be articulated from this project will actually help us to move towards ending those inequalities and make the vision and the dream of achieving 95-95-95 by 2026 a reality. I thank you all for this opportunity.
Another round of applause for Caroline. Thank you very much for that. Last and definitely not the least, I would like to invite to the podium a representative from NEP1. And if anybody has anything to say about Sidhas, it should be him. Ladies and gentlemen, please welcome with me Abdul Kader Ibrahim. Please, a round of applause for him.
the Honorable Minister of Health, ably represented by the Director of Public Health, my own brother, Dr. Gambo Aliyu, the Director General of NACA, the U.S. chargé d'affaires, the Chief of Party of FHI 360, Satish Raj Pandey, the Acting Country Director, my sister, Dr. Hadiza Kamofo, Dr. Akudo Ikpezu, the National Coordinator of NASCAP, the Country Director, UNAIDS, ably represented by my mother. She has mentioned that already, Mama Caroline. Other distinguished invited guests, gentlemen of the press, ladies and gentlemen, good afternoon. It gives me great pleasure to be here today at the end of project dissemination meeting of FHI 360 Sidhas project in my capacity as the national coordinator of the network of people living with HIV and AIDS in Nigeria, NEP1. So I bring you this goodwill message from all people living with HIV and AIDS in Nigeria. Today, we are gathered to mark the completion of USAID-funded Strengthening Integrated Delivery of HIV Services, Sidhas, which commenced in the year 2011 and which is being implemented by FHI 360. Permit me to inform you that NEP1 as a network has come this far, especially in the recent years, through the support and collaboration of our key partners and donors, paramount among which is FHI 360. As a sub-recipient of the Global Fund under FHI 360, in the past 5 years, NEP1 has been able to improve the quality of care and support to people living with HIV who are on treatment. This has resulted in high retention of clients on treatment, including recorded successes in prevention of mother-to-child transmission of HIV and AIDS across the implementation states. As we all know, with estimated 1.8 million people living with HIV and AIDS in Nigeria, Nigeria is the second largest number of PLHIV globally from the NICE reports. You will then agree with me that Sidhas has contributed in no small measure to the sectional integration of HIV and AIDS and TB services by building Nigeria's capacity to deliver sustainable and high and comprehensive prevention and treatment program in Nigeria. Another success story of the Sidhas is that at one time or the other, in the 10 years of its implementation, it was implemented across the 36 states of the Federation, including the FCT. In addition, FHI 360 and its partners and have worked with the government of Nigerian structure at all levels to strengthen our healthcare system for the provision of sustainable integrated healthcare service delivery for both HIV and other diseases which people living with HIV are beneficiaries. It is also on record that the Sidhas program facilitated the process of skill transfer and expertise to providers and managers at all levels of healthcare service delivery system through participatory, program and planning, implementation and monitoring and evaluation. Other notable achievements of Sidhas project include increased availability and accessibility of HIV prevention, care, support and treatment services, support to HIV testing and counseling for more than 18 million people, support to HIV testing and counseling over 4.6 million pregnant women, provision of antiretroviral medication for over 96,000 women who tested positive and prevention of mother-to-child transmission that prevent over 24,000 babies that will have been infected with HIV and AIDS. Support initiation of ARV for over 474,000 people, and provision of care and support to over 74,000 orphans and vulnerable children. For us, this is a remarkable achievement as people living with HIV. The NICE report is a testimony to your good work and other development partners in the fight against HIV and AIDS in Nigeria. With the prevalence rates in the country having dropped from 3.2 to 1.3%, is the heartwarming that all your intervention and effort did not go down the drain without any impact. These interventions will no doubt continue to have direct and indirect impact, as well as multiplier effect on the lives of people living with HIV. It is against this background that on behalf of the Board of Trustees, the Management Board, members and staff of NEP1, I sincerely wish to appreciate the management and staff of FHI 360 for the support we enjoy from you from time to time, and for your continued support and collaboration for the plight of people living with HIV. Once again, congratulations to FHI 360 on this successful completion of the Sidhas project in Nigeria. Before going down to my seat, I would like to note and acknowledge Ngozi Ezema, the Deputy Director of Program and Management, for her continued support and collaboration with NEP1. Thank you and best regards.
Thank you so much, Abdulkader, for that thumbs up to the Sidhas project. Now, before I call the next speaker, there's a saying in my place. You know, we like parties a lot in my part of the country. You would rather guess, I won't tell you where. You can just Google it. The party-loving people. So after a very successful party, there's usually the way people greet each other. They will usually say, we thank those that cooked. We also thank those that ate. Because, I mean, if you cook and there's no one to eat it, it's not a successful party. But then I'll say, most importantly, we thank the person that paid for this party. Ladies and gentlemen, everything you are seeing here today was made possible by the very, very generous support of the American people. And we will be remiss if we do not acknowledge and showcase that. And we have none other than the chargé d'affaires. Believe me, I Googled that word. Of the U.S. Embassy in Nigeria, Kathleen Fitzgibbon, for her comments today. Ladies and gentlemen, with a very warm and resounding applause, kindly welcome with me, Kathleen Fitzgibbon. Please let the applause usher her to the podium, please. Thank you.
Good afternoon. Actually, can everybody see me over the podium? It's a first. Good afternoon, and I just want to say thanks to everyone who's here, including the Director of Public Health, Dr. Gambo Aliyu, our state colleagues who we met out in Akwa Ibom, and soon I'll go out to Cross River. The other folks from the UN agencies who are our partners in all of these endeavors, and actually the people living with AIDS who are the true heroes of about what we're going to celebrate today. So I'd like to say thank you on behalf of PEPFAR, which is the President's Emergency Plan for AIDS Relief, and USAID for supporting this very worthy program for the last 10 years. Over the past 2 years, it's been a great source of pride for me to be response. Nigeria is now at a point where HIV epidemic control is now within our reach, in no small measure due to the contribution of the 10-year Strengthening Integrated Delivery of HIV/AIDS Services activity known as Sidhas. During my first tour in Nigeria, Presidents Clinton and Obasanjo started the fight against HIV in 2000, and I was part of the first continent-wide Heads of State Summit on HIV here in 2001. This is when the diagnosis of an HIV diagnosis represented a death sentence. Today in Nigeria, more than 1.5 million HIV-positive Nigerians are receiving antiretroviral treatment and living healthy, productive, dignified lives that are free from stigma and discrimination. That's more than 83% of the estimated 1.8 million adults in Nigeria infected with HIV. Nigeria is on the verge of epidemic control within the next 2 years. I need to stop here for a minute so you can all let that sink in. Every person in this room has been part of that success story. So we are on the verge of epidemic control within 2 years. And that's just amazing, given what I saw 20 years ago. So whether or not you are at the national level, or you're at the state level, in the SACAs or the state ministries of health, our partners, our UN partners, our people living with HIV, all of us are going to share in that success in the next 2 years. Some of us will have moved on to other posts, but that day is going to be a very big day in my Foreign Service career, is to see that happen. So why are we on the verge of HIV epidemic control? It's because of our focused, data-driven, and patient-centric approach to identifying and putting individuals on treatment. And I thank you, Dr. Gambo Aliyu and others, for challenging the way in which we were approaching HIV, which is almost a shotgun approach, right? Spread money across a number of states. When we started the NICE survey, I don't think anybody realized what a catalyst that was going to be for our success. But once we were able to identify those high-burden states, we were able to focus our activities and then working with these willing partners. Katie Donahoe and I visited Akwa Ibom last year, where we could actually see on the ground the whole range of patient-centric activities, and that's what's made the difference, right? Because over the last year, we were all suffering from the COVID epidemic. We were really worried about where our HIV programs were going to go. But having launched our surge activities in all of your states, in Cross River and Akwa Ibom in particular, River State as well, we were able to enlist the political support and political will we needed from the governors of the states, which I hope in turn empowered our health commissioners and our SACAs with working closely with the National AIDS Control Agency. All of us together were able to think through how do we deliver services when we can't move around. And I think all of our efforts for these past 10 years have come together last year and showed when we were able to put 350,000 new patients on HIV life-saving drugs. 350,000 at the height of the pandemic, which is absolutely astounding. And 500,000 since our surge activity began. This is all due to the fact that we thought about the patients first. We delivered the services in a way in which they could receive them and use them. And the ability, and I think we were just talking about the viral load suppression. People who get on treatment stay on treatment. And that's not an easy thing to do in this environment. So I really think we have to think through all of those things that we all did together to determine what was it that will help keep those people on treatment. And our next phase of our fight is going to be sustainability, and something we're working with NACA, the SACAs, and the different health ministers on. But I wanted to say that I'm so proud of where we've come, and the last 2 years really showed how much foundation work was done. And you never see the foundation work until you're getting close to the end, right? But those numbers and being able to give data to show our success is important. But we all know behind those numbers are people. And it was the fact that we took a look at this, at how people received health information, or we could access people, or they could access health services, and ended user fees, tried to end stigma, which there is still stigma out there. It's still another challenge we need to finish the fight on. But because we did all of that, this is how close we are to a major, major health success story. So I want us to be very proud of that. And here in Nigeria, the way that we did it within our U.S. mission was through a very multidisciplinary and interagency PEPFAR team that worked very closely with our government stakeholders and UN stakeholders to reorient the national response to address the low treatment coverage as we identified it in the 2018 NICE survey to high treatment coverage in a very short period of time. USAID's Sidhas activity played a key role in what became an enormously successful surge activity to accelerate access to these life-saving antiretrovirals. This made the remarkable progress in Akwa Ibom and Cross River states in particular, giving us 500,000 more patients on treatment as part of our larger response. It's absolutely amazing. The antiretroviral program surge activity was a historic scale-up of services that dramatically changed the story of HIV in this country. And the fact that the surge took place during the COVID-19 pandemic makes this success even more impressive. So over the years, Sidhas introduced and honed a paradigm shift in HIV implementation, from emergency response to a more country-led, evidence-based approach focusing on helping Nigeria improve its health systems at the federal, state, and local levels. Sidhas has ably adapted to the changes in HIV epidemiology, scientific advancements, and different government policies, all with the single objective of saving lives and working towards an HIV-free generation, which is something that's also in our sights. It's helped Nigeria implement and scale up new national guidelines, nurtured innovation, and a testing of new medical care, models of medical care. The strong U.S. commitment to HIV control in Nigeria will continue through other existing and future activities of prevention, care, treatment, services, building on the success of this program. The U.S. is also proud to contribute to progress worldwide, and since 2003, the inception of PEPFAR, the United States has invested more than $85 billion in the global HIV response and over $6 billion here in Nigeria. And PEPFAR has saved an estimated 20 million lives around the world, prevented millions of HIV infections, supported multiple countries to achieve HIV epidemic control, all while significantly strengthening global health security. This includes PEPFAR support for approximately 1/3 of the entire global fund to fight HIV, tuberculosis, and malaria's efforts. So on behalf of the United States government, I would like to thank the Nigerian government, especially the Ministry of Health and the National AIDS Control Agency and its state counterparts, donors, implementing partners, other stakeholders, and particularly the people who are living with HIV, who had the courage to stand up and get tested and show that HIV can be defeated in our lifetime. So I really have to give them the biggest round of applause, because without the people living with HIV and their feedback to us as to what they needed, your voices were heard. And I think that our success right now is a good example of how, when feedback is two ways, we can succeed. So I'm very proud of people who stand up and get tested. The PEPFAR team does look forward to keeping up the good work with all of you. We'll keep making our rounds around the country because now, after we achieve epidemic control, we're going for the HIV-free generation. So I want to thank everybody here, that we all have the shared commitment, shared goals, and we still have to keep up the good work. We're sad to see this program closing, but it is the basis for a lot of our success, and we should be very proud of that. So thank you very much, FSI 360.
Please, can we have another round of applause? I was practically following each word, and by the time she got to the point of the surge, Ella was just going through. Please, if you're part of the surge, can I see your hands up? Everyone. Those were really, really. I remember when they say, Kola, we have to do the surge. I say, okay, what is the surge? We have to place everybody. I mean, everybody. They said, yes, everybody. And I said, how do you do that? Just go for it. And 2 years down the line, it's been a huge success story, and it was a fitting conclusion to the Sidhas project, and that impact will be felt. I mean, 2 years down the line, we are getting to epidemic control, and that story will not be complete without the Sidhas project. Ladies and gentlemen, please give a very resounding applause. Being part of the Sidhas project is something you tell your grandchildren. Now, HIV, no, what is HIV? Yes, we were part of what made that happen, because you don't see that anymore. Ladies and gentlemen, at this point, I would like to invite the chief host. The story is the story of Nigeria. With the support of the American people, the story of Nigeria changed with regards to the trajectory of HIV/AIDS. And no less a person than the Honorable Minister of Health is here, ably represented by the Director, Public Health, Federal Ministry of Health, Dr. M.O. Alex Oko. Ladies and gentlemen, please a big round of applause for her. You can see that our mask is firmly on our face. You're welcome, ma'am.
The Honorable Commissioner for Health, Akwa Ibom State. The Honorable Commissioner for Health, Cross River State, ably represented by the State AIDS Program Coordinator, the DG NACA, the U.S. Charge d'Affaires, the Acting Country Director, FHI 360, the National Coordinator, NASCAP, Dr. Akudo, representatives of UNAIDS and other development partners, representatives of NEFWEN and other communities, distinguished ladies and gentlemen in the hall and online, good afternoon. I bring you greetings from the Honorable Minister of Health, who is unable to be here due to the exigencies of duty, and I have the honor and privilege to represent him. I will be reading his address. It is my honor to join you at this event, which formally marks the end of the Sidhas project. The last 10 years have been remarkable for the HIV response. During this period, we have seen a drop in the HIV prevalence rates and significant growth in the coverage of ART for people living with HIV from 400,000 in 2011 to the current number of 1,629,427 as of June this year. I have been informed that among other achievements, the Sidhas project contributed to these numbers by supporting initiation of treatment for over 450,000 people living with HIV. It is therefore my pleasure to be here with you to acknowledge the contributions and successful implementation of the project. I would like to express my appreciation through the Charge d'Affaires to the United States government for the financial and technical contributions through this project. I also recognize the many individuals, technical teams, other implementing organizations, and the government entities that were involved in making this project a success. There is no doubt that leadership and collaboration are important, and I must thank the leadership of USAID and PEPFAR for the strong support. As with every development effort, there will be many lessons learned about what can be improved upon and how these can be used to strengthen work in the future. We look forward to learning from this important project. To a large extent, the progress recorded in Nigeria's HIV response in the last 10 years can be attributed partly to the significant financial investments into the program during this period. As we get closer to achieving epidemic control in Nigeria, the discourse has shifted more and more to emphasize the need for greater sustainability. I recognize the need to view sustainability from a broad base, which includes and addresses programmatic, epidemiologic, and financial sustainability. Building on our commitment to more responsive ownership and increased domestic investment, as you may already know, this year the Ministry of Health is contributing 4.2 million rapid test kits into the national commodities pool. We are also repositioning the National Health Insurance Scheme to ensure greater access to quality health care for all Nigerians. The scheme is tasked to expand coverage to 70% of Nigerians through both formal and informal sectors by 2030. I'm glad to tell you that states' insurance schemes are becoming vibrant and taking up some infections of public health importance, including tuberculosis. The Basic Health Care Provision Fund will also provide a strong base for sustained funding of primary health care and will help address the gaps in ANC coverage and PMTCT especially. I would like to end by once again lauding the achievements of the Sidhas project. I appreciate USAID for funding this project, as well as FHI 360 for the successful delivery of the project's objectives. Congratulations and thank you.
Please, that's the chief host. Kindly make your applause more resounding. Thank you very much, Ma. As we proceed, without fail, we will be thanking a number of you. We have more than 160 plaques to hand out, but today we'll just do 4 or 5 because of time. And I would like to invite to the podium the Chargée d'Affaires, Kathleen Fitzgibbon, to hand out some of the plaques. Ladies and gentlemen, the Chargée d'Affaires. Okay, so please. I'll feel. Okay. Thank you. So, allow me call them. Yes. All right. So the first one goes to Naka. You shouldn't be surprised, sir. Here represented by Dr. Gambo Aliyu, who is the Director General, and also the Chairman of the Project Advisory Committee. One of the successes is the facilitation of the National Council of Health commitment to at least 0.5% of state funds to HIV response. NACA. Ladies and gentlemen, give it up for NACA. Thank you. Okay. Thank you. Another round of applause. Okay. The next one is for the Akwa Ibom State Government. Ladies and gentlemen, Professor Augustine Umor is the Honorable Commissioner for the Akwa Ibom State, Commissioner of Health for Akwa Ibom State Government, and he's been a source of huge support to the Sidhas team and is consistently providing an enabling environment in the state. Ladies and gentlemen, Professor Augustine Umor. A round of applause, please. Thank you. Yes. Next is the Cross River State Government, here represented by the Honorable Commissioner for Health, who is represented by the State AIDS Program Coordinator, Mary Ama. Please, a round of applause for her, please. Well, I think this way, yes. We will have to recognize them without their masks, either way. Thank you. Last but definitely not the least is the network of people living with HIV/AIDS, here represented by Abdul Kader Ibrahim, who serves as the president, as the national coordinator. Mr. Ibrahim, a round of applause for him, is a human rights activist with strong leadership skills and has spent more than 10 years working as a human rights activist and HIV advocate across the country. Congratulations. I think he has a plaque. Okay, okay. All right. Okay, just a second, pardon me, because this is such an auspicious occasion. I would like to invite the managing director for Annie, Nkiru Wadioke. Annie has been at the forefront of this intervention. Please give her a big round of applause. Because it's not every day you get to see the charge, the affairs. And, no, they don't let you out. All right. Thank you. Getting ready. Yes. All right. Getting ready and to come next is the country director for Howard Global Initiative in Nigeria, Dr. Dorothy Okwa. Now, without them, I'm not sure we would have had a very resounding, the kind of success we've had. Thank you very much. Okay, that's the new kind of handshake. It's called the elbow bump. You saw it here first. Okay, congratulations. Distinguished guests, ladies and gentlemen, kindly with a big applause, usher yourself. Thank you so much. I would like to just acknowledge a number of people. The Deputy Mission Director, Katie Donahoe. Please wave at us. Yes. In the olden days, you remove your hat, but these days you remove your mask and say hi. I would also like to Yves Corey. I'm the agreement officer. Wave at us. Yes. I would like to also, Dr. Ezekiel is very dear to me. I have to use the opportunity. Please wave at us. Now, we have some luminaries. And please give a big round of applause. Dr. Ezekiel is the AOR for Sidhas. Please a big round of applause for him. Yes. All right. So he was representing you. You are the AO and he's the R of the, okay. Nice to finally meet you, sir. All right. Now we have the country director for CDC with in our midst, Adetinuke Mary Boyd, as well as the country director for DOD Walter Reed, Laura Chittenden. Did I get that? Please a round of applause for me. I'm getting all the names right. And we will come round to the other folks. Now, there's someone we have not, I would request him to honorably take a bow. Satish Raj Pandey is the chief of party of the Sidhas project. Please, thank you very much. Now, what was done over the last 10 years will be difficult to paraphrase in 10 minutes or 20 minutes, but we'll try to do just that. We have a video session. Kindly just watch it, because we want to put as much into details of what was done in the last 10 years, so that we can have an idea of the scale and the scope of what was done. So for the next 20 minutes or thereabout, we are going to be watching a video presentation showcasing the Sidhas journey of the last 10 years. Ladies and gentlemen, we present to you the movie entitled The Last 10 Years of the Sidhas Journey. Please sit back, relax, and enjoy it. Thank you very much.
2011. This year marked a very important year for the global HIV response. After 30 years of relentless scourge, 2011 marked several breakthroughs in global solidarity and technical advances. The 2011 Political Declaration on HIV and AIDS committed to intensify efforts to reach universal access. And this was a very critical consensus at the time, because in 2011, only about 54% of the estimated 14.8 million people eligible for treatment were receiving it. At the onset of the Strengthening Integrated Delivery of HIV and AIDS Services, also referred to as the Sidhas project in 2011, Nigeria's HIV program was starting to make progress, the national prevalence having reduced from a peak of 5.8% in 2001 to 3.6%. The preceding 7-year PEPFAR-funded Global HIV/AIDS Initiative Nigeria, commonly called the GAIN Project, through USAID, implemented from 2004 to 2011 by an FHI-led consortium, also contributed to this achievement, accounting for over a third of clients initiated on antiretroviral treatment in Nigeria. However, there was still work to do. At the close of 2012, only 30% of persons requiring antiretroviral medications were accessing it. According to PEPFAR's Nigeria Country Operational Plan for 2012, at the beginning of Sidhas, Nigeria had an estimated 2.98 million people living with HIV, the second greatest burden of HIV care and treatment worldwide. An estimated 2.8 million children had been orphaned by HIV since the first case was identified in 1986 in Nigeria. The country was facing a generalized epidemic, with prevalence at 3.6% for the 15 to 49 age group, and women accounting for close to 60% of all adults living with HIV. In response to this picture, PEPFAR in Nigeria used its country operational plan investments to realign its impact approach into key priority areas, including the delivery of high-impact service interventions, particularly at the primary healthcare level, greater focus on women and children, a shift in focus for technical assistance to the government of Nigeria from national to both state and local levels of government to improve capacity in planning, management, and the leadership of HIV/AIDS and TB programs, improved human resources for health, strengthened leadership, management, governance, and accountability for program ownership and sustainability. Sidhas was designed to address these priorities. The goal was to sustain cross-sectional integration of HIV/AIDS and TB services by building Nigerian capacity to deliver sustainable, high-quality, comprehensive prevention care, treatment, and related services. Implementation began in September 2011. Designed as a 5-year project, it was extended to last for 10 years. Sidhas was implemented by a consortium of 9 partners, 6 core and 3 technical assistance partners, led by FHI 360. Over the course of the project, the strategic framework was modified to respond to the dynamic nature of the epidemic and PEPFAR priorities. The initial focus was sustainability, with emphasis on building the capacity of the government of Nigeria institutions while integrating HIV services into routine healthcare and strengthening community systems across the 36+1 states. Sidhas implementation sites were supported with funding from both PEPFAR and the Global Fund. In order to ensure proper attribution and accountability, support for these sites was split between PEPFAR and the Global Fund so that in 2013, Sidhas realigned to work in 15 states and to focus on a rapid scale-up of prevention of mother-to-child transmission and antiretroviral services to sustain the reach of PEPFAR HIV/AIDS services. Part of the approach was scaling up private sector engagement and provision of emergency support to the Northeast to address the impacts of insecurity on the provision of HIV services in that region. Over the next 6 years, there were multiple categorizations and realignments of initially state and then local government areas, with significantly more interventions targeted at areas with high unmet HIV need in a bid to better direct available resources at the flashpoints of the epidemic. This was done while retaining a focus on achieving sustainability with 2 states, Abia and Taraba, which were eventually transitioned to the government of Nigeria in 2015. In addition, a large number of low-volume facilities were also transitioned to the government of Nigeria across the remaining 13 supported states. The National AIDS Indicator and Impact Survey, NAIS, was done in 2019, leading to a pivot for Sidhas in 2 states, Akwa Ibom and Cross River, to support the achievement of epidemic control. Over the past 10 years, Sidhas has implemented interventions in line with PEPFAR guidance to control the pandemic and ensure that people living with HIV in Nigeria receive high-quality HIV/AIDS services. With the advent of UNAIDS targets, first 390s and then the 395s, the Sidhas project adapted strategies, innovated and strengthened its systems to achieve these goals. The project rolled out various approaches to HIV case finding, which included voluntary counseling and testing, provider-initiated testing and counseling, community outreaches through community-based organizations and faith-based organizations. These were implemented at the community level to ensure most at-risk populations, especially sex workers and other vulnerable populations, had increased access to HIV services in the 36 states and the FCT. With PEPFAR's timely overall guidance about priorities helping to shape Sidhas' direction and increase efficiency, the project rolled out innovative testing strategies, which led to dramatically improved case finding while ensuring efficient use of resources. The result? Over 18 million persons were provided with HIV testing services, and over 697,000 persons were identified as HIV positive, of which over 474,000 were successfully linked to care within the life of the project. To improve retention rates for clients on treatment, multiple differentiated service delivery models were set up across both the facilities and the communities. Sidhas also transitioned to the use of tenofovir, lamivudine, and dolutegravir as the preferred first-line regimen. The case management approach, rolled out in 2017, was a key innovation. The goal was to establish better connections between health facilities and communities, and assist the facilities to conduct tracking and reduce the number of clients lost to follow-up. As a result of all these innovative client-centered approaches, the Sidhas project's retention improved from an initial 32% retention rate to a closing proxy retention of over 98% by the end of the project. Sidhas pivoted from the use of the CD4 assay as a monitoring tool to the viral load assay and scaled up its use across the project through a variety of innovative strategies. Client management approaches like enhanced adherence counseling were employed to help unsuppressed clients achieve suppression. At the end of the project, of all eligible clients who had been provided viral load testing services, 98% of them were virally suppressed, of which 86% had undetectable levels of HIV virus in their systems. In the last 10 years, a key priority of PEPFAR and consequently Sidhas was a greater focus on women and children. Sidhas identified and implemented strategies to strengthen PMTCT services for pregnant women and breastfeeding women. Between February 2013 and March 2014, Sidhas undertook the rapid scale-up of PMTCT services in government-owned and private-owned health facilities. 2,044 additional health facilities were activated, increasing facility coverage from 8% to 50%, yielding a 246% increase in access to HIV testing services by pregnant women, and also a 152% increase in access to antiretroviral treatments. To optimize early infant diagnosis among HIV-exposed infants, Sidhas expanded EID services to all activated sites and introduced enhanced postnatal prophylaxis for all high-risk infants. At the end of the Sidhas 10-year cycle, 4,648,000 new antenatal attendees had their HIV status determined, 108,000 were identified as HIV positive, and 96,000 started on antiretroviral treatment. As a result of Sidhas' efforts to prevent mother-to-child transmission of HIV, over 24,000 HIV-exposed infants received a negative DNA PCR result. Sidhas also deployed a variety of strategies to strengthen comprehensive HIV service provision for children and adolescents living with HIV, and improve antiretroviral coverage among children in supported states. In total, Sidhas identified over 31,000 HIV-positive children and put over 22,000 on treatment, with 95% achieving viral load suppression. In April 2019, the National HIV/AIDS Indicator and Impact Survey report announced 5.5% HIV prevalence in Akwa Ibom. As part of USAID's concerted efforts to address the HIV burden in Akwa Ibom State, Sidhas implemented the surge intervention, which was a collection of innovative and disruptive program approaches designed to address drivers of the epidemic, overcome structural and institutional barriers, and rapidly scale up access to antiretroviral therapy. This included the onboarding of 73 community antiretroviral treatment teams to aggressively pursue case finding across 31 local government areas of implementation, enhance site management, and strengthen the use of strategic information to influence data-driven interventions using daily situation room meetings, which were virtual meetings set up to jointly review daily progress on key indicators. A similar surge intervention was also implemented in supported local government areas in Cross River State, with 21 community antiretroviral treatment teams onboarded in order to accelerate surge activities. Both the Akwa Ibom and Cross River State governments played critical roles in creating an enabling working and policy environment for the surge to kick off and maintain momentum over the years, and even well after the end of Sidhas. These two surge states are currently on track to achieve epidemic control. The Northeast region was one of the most challenging Sidhas locations. Sidhas worked in the northeastern states of Adamawa, Borno, and Yobe since the onset of the project. The rise in insurgency across the region severely affected implementation, especially in Borno State, which saw a significant proportion of Sidhas clients displaced from their homes and thus unable to access HIV services. Sidhas responded to the situation by coordinating with the humanitarian health sector response to provide services to the internally displaced persons in camps and integrating displaced healthcare workers into the Sidhas response team, while collaborating with the state governments as well as other humanitarian development partners. Sidhas worked in the state throughout the conflict period, providing care to up to 28,000 persons as of March 2020. Over 50% of Nigerians receive healthcare services from the private sector. Sidhas already had a strong history of working with private faith-based organizations, and it expanded the pool of providers to include private for-profit hospitals and community pharmacies. Sidhas was provided with additional resources under the Sustainable Financing Initiative, funded by PEPFAR through United States Agency for International Development, as part of its strategy to promote mobilization of domestic resources for the HIV response. Using this funding, 624 healthcare workers in private health facilities and 421 community pharmacists were trained and mentored on delivery of high-quality antiretroviral services and antiretroviral refill services, respectively. A total of 122 private health facilities were activated to provide comprehensive HIV/AIDS services, and they served 4,057 clients who were willing and able to pay for premium services. 320 community pharmacy outlets were activated to provide antiretroviral refill services to over 15,000 people living with HIV, evolved from public facilities. The engagement with the private laboratories was implemented in Union Diagnostic Laboratory, Lagos, and Intercontinental Diagnostics Laboratory in Port Harcourt, and involved the placement of 2 Abbott M2000 automated PCR machines in these labs at no additional cost to the project, with 699 tests conducted in these labs. The COVID-19 pandemic affected everyone, and Sidhas was not exempted. In March 2020, Nigeria, like most countries worldwide, instituted a national lockdown. The movement restriction occasioned by the lockdown had the potential to disrupt the gains of the recent HIV epidemic control efforts in the country. In response to this global crisis, the Sidhas team developed innovative solutions to provide services to its clients, whilst ensuring that both staff and providers were protected while maintaining client-centric services, despite the mobility and safety challenges posed by the pandemic. Notable efforts include the front-loading of antiretroviral drugs and the scale-up of multi-month dispensing to reduce the frequency of contact between clients and providers, scaling up the use of community-based differentiated drug distribution models to bring services even closer to the clients. Sidhas pioneered telemedicine approaches for enhanced adherence counseling for virally unsuppressed clients and optimized automated data quality processes using teleconferencing, social media platforms, and health informatics. Sidhas was designed to improve stewardship by Nigerian institutions for the provision of high-quality comprehensive HIV/AIDS and TB through a systematic approach that shifts the leadership and ownership of HIV/AIDS services from donors to the host governments. Sidhas supported the development of sustainability roadmaps for supported state and federal tertiary facilities at the time, in 12 state roadmaps and 1 tertiary facility roadmap covering all supported federal tertiary facilities. These were developed by the leadership of state agencies for the control of AIDS, the Ministry of Health for the states, and the senior management teams for the tertiary facilities. In 2017, the roadmaps were presented to and adopted by the Federal Ministry of Health, represented by the Honorable Minister for Health, Professor Isaac Adewale, Honorable Commissioners of Health, and Chief Medical Directors of the respective entities, and is seen as a blueprint towards the achievement of HIV service sustainability in the country. In line with PEPFAR's new strategy, Sidhas initiated the provision of cervical cancer screening services for all eligible female persons living with HIV. By the end of the Sidhas project, 73 health facilities had commenced screening, with over 13,000 HIV-positive females screened and women who screened positive for precancerous lesions treated using thermal ablation. Women are disproportionately affected with and by HIV. A gender-sensitive approach to the HIV response can provide the much-required foundation to manage this unbalanced situation. Sidhas implemented gender integration activities, which yielded over 87,000 individuals reached with interventions that address gender norms, over 13,000 survivors receiving post-GBV care for physical and emotional violence, and over 9,000 survivors receiving post-sexual violence care, with over 6,000 survivors of sexual violence reporting at the health facility within 72 hours and receiving post-exposure prophylaxis to prevent the transmission of HIV. Sidhas started assistance to local organizations in 2011. Over 140 entities from 18 states were targeted for financial and institutional capacity building. Through financial management trainings, Sidhas helped 13 faith-based and community-based organizations in Nigeria to receive more than $800,000 in new grants and awards. 9 community-based organizations won 8 new HIV projects. Overall, Sidhas support helped local organizations become more independent, financially sustainable, and responsible for providing services. Over the past decade, the Sidhas project has been a hub and frontrunner in the design and development of both strategic and automated innovations to strengthen health systems. Sidhas deployed cutting-edge health technology interventions, which have proven to be instrumental in HIV programming in Nigeria. These include the National OVC Management Information System to aggregate and monitor OVC program achievements. In keeping with this sustainability mandate, Sidhas transited the NOMIS software to the Government of Nigeria in care of the Federal Ministry of Women Affairs and Social Development. The Lafia Management Information System (LAMIS) is an electronic patient management, monitoring, and inventory management record system. Ever since its deployment in 2007 under the Global HIV/AIDS Initiative Nigeria GAIN project, it has since significantly evolved under the Sidhas project to be a globally recognized standard electronic medical record software, as well as the catalyst for the development of a centralized electronic medical record system for all USAID implementing partners in Nigeria. To further respond to the demands of the dynamic HIV/AIDS program, Sidhas developed mobile software iterations of the LAMIS software, LAMIS Lite, and the decentralized drug distribution mobile applications for community implementation. Significant investments made through Sidhas are a testimony of PEPFAR and USAID's long-standing commitment to supporting Nigeria in its HIV/AIDS response. The project has demonstrated innovative and efficient ways of scaling up HIV interventions to move towards epidemic control and contain the spread of HIV and mitigate its impact. The experiences and lessons learned from Sidhas will continue to contribute to efforts to reach epidemic control in Nigeria. A united and well-harmonized response built on solidarity among all key stakeholders and led through local ownership, will enable Nigeria to sustain these successes and create an AIDS-free generation.
Another round of applause. It's not easy to put 10 years of work in 20 minutes, but obviously a lot has been done in the last 10 years. And at some point I was actually getting emotional because I cut my teeth on the Sidhas project, and I am so happy to see it today. And so to everyone that has worked, and is working to keep our people alive and healthy, living with HIV, let's give ourselves another round of applause. And I was thinking to myself, anytime my grandchildren tell me, "Daddy, what did you do with yourself?" I'll just play them this video. Fantastic work. Thank you very much. As we round it up, I would like to invite Dr. Hadiza Kamofu to unveil the closeout documentation package. It's a lot has been done. At times we had to formulate strategies where none existed. Because, there was no blueprint. We had to just, how do you treat everyone? And we've taken the time. I'm saying we, okay. We have taken the time to put together a package. And I would like to invite, okay, I'm not inviting her. Dr. Akudo Ikpeazu. Please, a big round of applause for her. You may not recognize her with the mask on, but she was front and center of the intervention as the national coordinator for NASCAP. Ladies and gentlemen, Dr. Hadiza Kamofu.
I'm back again, and thank you for staying through with us. We'd like the documents to be shown on the screen as we briefly just highlight what you should expect. So most of these documents are actually packaged and put together in a flash drive. In the interest of our environment and also for cost efficiency, we have decided to package all these things in a flash drive, and which is contained in your bag. So you make sure you have received it before you leave. And as you can imagine, for 10 years, Sidhas has a lot, tons and tons of documentation, starting from abstracts in workshops and conferences. Every year we participate in several conferences. We have full journal publications in scientific journals. We also have monographs, technical briefs. We have quite a number of innovation documents, success stories, lessons learned, lots and lots of documents. Some of them will be on display at the exhibition booth, and we'll encourage you to stay behind and make sure you go through the exhibition stands so you can see some of these things. As we have mentioned earlier, it's difficult to package 10 years of work, incredible work, into 1 hour. So we are really, really struggling. And some of us were actually at the beginning of this project and have spent 10 years of our lives on this project, and we are very, very proud. So having said that, I will hand over to Akudo to say a few words.
Good afternoon, everyone. And just to join everyone who has spoken before me to say mighty congratulations. It's been an incredible 10 years. When I looked at the time, 10 years, I recall when Sidhas was being launched and was being started, and it was quite a surprise to see that 10 years have gone by. But it is good to also know that there's been a lot of success. So congratulations to the team. And I joined the Honorable Minister's representative, Dr. Alex Oko, to say well done to everybody. Thank you.
Thank you. We are coming or about to end this very, very auspicious event, and we will be having the vote of thanks. But before the AOR for Sidhas comes up, we have lunch, a socially distanced lunch, and COVID-compliant lunch. We also have extensive information in the gallery outside. So we have an exhibition stand. Please take your time. Don't rush. I mean, imbibe what was done by the Sidhas project over the course of 10 years. We've literally changed the trajectory of HIV/AIDS globally, and I'm sure we're all proud to be a part of that. To close this meeting will be someone who has always been there. It's just like the Northern Star, Dr. Ezekiel James. Please come forward. Please, a big round of applause for him.
So in the interest of time, let me respectfully stand on already established protocols and say good afternoon, everyone. Let me start this vote of thanks. My job is very simple. I'm supposed to give a vote of thanks. But I want to start the vote of thanks by expressing how joyful I am today. Seeing this project that started very small 10 years ago, and for which I've been part of since its award 10 years ago, and being part of the closeout today makes me very, very joyful. And I'm so happy to be part of this occasion today. I want to, on behalf of the agreement officer who is here, he delegated that responsibility to me, and on behalf of the U.S. Embassy, and specifically on behalf of USAID that I represent. And just like the MC said, USAID, through PEPFAR, gave the funds for us to be able to prepare the meal and serve the people. So I represent that organization this evening. And on behalf of that organization, I want to say a very big thank you to everyone who has been part of this success story. It's been a long journey. It's been a great, long journey. And I want to say thank you to everyone for being part of this success story. But specifically, I must not fail to express my heartfelt gratitude to the Honorable Minister of Health, ably represented by the Director of Public Health this afternoon, who incidentally is also the chief host at this event. And my thanks to the Chargé d'Affaires, Kathleen Fitzgibbon, for making out time out of their very busy schedule to honor this invitation. I want to say thank you very much, Minister, Honorable Minister, and thank you very much, Kathleen, for being part of this event. My appreciation also goes to the government of Nigeria, also represented here, not just the minister, but we have had in our midst, I'm sure he just left now, the Director General of NACA, and our sister too, the National Coordinator of NASCAP, Dr. Akudo Ikpeazu. Thank you both as the government that have given us the opportunity as funders to cooperate and collaborate together to make this fit to happen today. I want to say thank you to you and to NACA. Let me also thank particularly the two states that ultimately became 2 out of the 36 plus 1, where ultimately the Sidhas project dovetailed. 10 years ago, we started from 36 plus 1, but we are closing today in 2 states. Those were not the only 2 states that benefited, the entire country benefited, but just to appreciate that these 2 states, particularly over the past 2-3 years, have been very, very great in the collaboration and the cooperation that we've received from the 2 states. Both states are represented today by the Commissioner of Health, particularly Professor Umo from Akwa Ibom State, who himself is here. Thank you very much, sir. And the permanent secretary from Akwa Ibom State is being a part of the project. Is always there. He's been there for USAID. He's been there for FHI 360. We want to thank you very much. To our sister state in Cross River, we also want to thank you. The commissioner promised, but just like we were told, she was not able to make it, but she was ably represented this afternoon. So thank you to the two states that gave the enabling environment for USAID to be able to implement in those two states and be part of this achievement that we all are celebrating today. To our beneficiaries, I say a big thank you. Because without you, there wouldn't have been a project in the first place. The project existed because there were consumers to be served. So we want to thank you for your patronage. We want to thank you for your constructive feedback over the years. And we've received quite a number that have helped to shape and made the project better along the line and brought us to where we are today. And not just that, we also want to thank you for the numerous success stories you shared about how your lives have been positively impacted through the support from the American people. We just had another testimony today from Cross River State. That is the kind of stories that we've received over this past 10 years. There's a compendium of that I know every time Sidhas submits their quarterly reports, it comes with wonderful success stories of people who have received tremendous support and whose lives have changed based on the support through the American people. So I want to thank our beneficiaries. To all the implementing partners, sub-partners, we can see Annie here and even Howard University, the civil society organizations, and the community-based organizations who worked very closely and collaboratively with FHI 360 over the years to achieve this feat. We are indeed grateful to you. Of course, I cannot but say a big thank you to my USAID Mission Director, ably represented by the Deputy Mission Director, Kathy. I want to thank you. Thank you for your support over the years. I want to thank my Office Director, Rachel, though she just came about a year ago, but since that 1 year, it's been a big support that I have received as the AOR to this project. I also want to thank all of my colleagues in the Heart Office and at USAID. Thank you so much for your critical support. Thank you for your guidance. Thank you for your feedback at different times. To Zach and Amarachi, you guys rock. Please help me give them a round of applause, both of them. Thanks to you both for the invaluable support you provided, especially over the last few days and into the weekend, and even the American holiday yesterday. Going the extra mile to review and clear the packages from FHI 360 for this event. Thank you so very much. They really didn't sleep in the last 48 hours. Every 5 minutes, Satish was having a package to share with them. And I was just saying, oh my God. In fact, I told them, I said, look, Monday is an American holiday, so if you don't get it done by Friday, forget it. Zach called me and said, don't tell them, but I'm ready to work for them even on Monday. Thank you so very much. Last but certainly not the least, let me thank all Sidhas staff and volunteers. Some of them said 8 years. They were all just coming, getting introduced in the state office, country office, all the staff and volunteers who worked on this project at different times. You guys were the foot soldiers. You are the boot on ground that made the difference. We appreciate your commitment. We appreciate your doggedness. And we appreciate your resilience through the good and difficult periods. Thank you for contributing your quota towards making the project a huge success that we all are celebrating today. I wish everyone safe travels back to our different destinations. Thank you all, and God bless.
Thank you very much, Dr. Ezekiel James. Another round of applause for him. And thank you, Dr. Ezekiel. I'm not sure you thanked yourself. we have come to the end of this very auspicious event. And I'll just summarize by quoting again that statement I mentioned that is a statement very common where we've successfully done something. We thank those that cooked, all the partners, everyone. We thank those that ate, all the beneficiaries, NEP1. We thank the owner of the house, the government of Nigeria, Akwa Ibom State, across River State, 36 plus 1 states. But most importantly, we thank the person that paid for it all, the US government. Ladies and gentlemen, can we all give ourselves a big round of applause? We have ended, really. Let's just give ourselves a big round of applause. I'm feeling emotional right now. All right, so we have lunch at the Tamarind A and B hall. It's just out there, and it's quite a spread. Try not to miss it. We also have the exhibition outside. Kindly take your time to enjoy it, and I do hope that you have a safe journey back to your respective domiciles. Thank you very much. It's been a pleasure hosting you. We have come to the end. Meeting is over. How do you say it online? Out. Thank you very much and have a great day ahead.